side rear end weakness, glute medius, glute minimus weakness is a common problem with the older population as well. Again, probably because they've been living longer, and so they've had a longer period of time for those muscles to get weak over time, especially because we don't tend to use those muscles much in daily life. So why are those muscles important? Basically, those muscles help stabilize our pelvis when we're walking. Now, back to the single leg part, right? So standing on a single leg is important for older individuals as well, people over the age of 70, 80, 90. Yes, staying on a single leg is important, I would say, but only up until a couple seconds, because they need to be able to step over an object. They need to be able to take a long, confident stride as they're walking. And so they need to be able to stand on a single leg for a short period of time and do that successfully on a regular basis. And of course, the side rear end muscles, the glute medius, glute minimus muscles, are a big part of being able to make that happen, because those muscles allow the pelvis to stay level. And of course, there's tightnesses and other weaknesses that can occur that can also contribute to this problem. And so you have a whole host of musculoskeletal causes that can add to or be the main cause of a balance problem. Along those lines, you can have what we call plantar flexion weakness, or basically weakness in the calf muscles that prevents the person from pushing their toes down. Now, if you can imagine, try walk, if you have a balance problem already, don't try this, but if you try to walk across the room, or if you try to balance yourself without pushing your toes into the ground at all, and basically see how difficult it is to balance yourself overall, you're going to find that it's quite difficult to balance yourself if you can't push your toes into the ground. And again, the treatment for this sort of problem is going to be very different compared to someone who doesn't have this problem, because a lot of times people will fall backwards when they're older, and that's the most common place to fall. They'll fall backwards. Now, if someone has a plantar flexion weakness problem, their biggest threat is actually falling forward, because they're not able to push their toes down and prevent themselves from going forward. Whereas if they don't have a plantar flexion problem, they can push their toes down just fine. They tend to fall backwards. And so these are the different dynamics that tend to happen with people when they have a balance problem. So generalized balance training, if it's not addressing the root cause of the balance problem, then that can lead to a situation where someone is able to get some better. As often our clients will say, they'll get some better, but they're not going to find as much potential as they would compared to if we figure out, okay, what's exactly going on.